Hi, I'm Rob McFadden. Today we're going to talk about as-needed medications for anxiety. I often have people say to me, well, my doctor's prescribed me an as-needed anxiety medication. How do I take it? I always encourage them to reflect back on what the conversation with her was, what the conversation with the doctor was. Did you two talk about antecedents? Did you talk about triggers? If not, it's probably a good idea to go back and have that discussion. Maybe they had something specific in mind. What I'm going to be talking to you today about is the kind of conversation I have with people about as-needed medications. Two general categories. First category is preventive. People anticipate the situations, monitor their physiology, or take advice. Let's talk about each of those separately. In a preventive situation, you're not looking to try to master anxiety or push yourself to see how you can do in an anxious situation. You just want to avoid your anxiety response completely. Okay, so how do you do that? First off, you have to anticipate these situations. Look at your schedule, go through your day, go through your week. Try your best to think about, is there going to be a board meeting? Are you going to be rounding with a difficult attending? Are you going to be making a presentation to a group? Are you going to be getting criticism or notes on a production you've done or a presentation you've done? Those are the cases where some amount of time, depending on the medicine, some amount of time before the situation, you take the medication. Before a flight, you take the medication. That way you avoid the anxious response completely. Number two, we can't always know that we're going to be in an anxious situation, so we have to monitor our physiology. And we're going to talk about this next. As soon as your physiology starts to creep up the hierarchy, maybe it's when you get to a 3 out of 10, you're noticing some tension in your neck, and you have some awareness that your situation has become an anxious one, that's when you take the preventive as-needed medication. And the third one is advice. If your husband, if your wife, if your best friend tells you, you're going to have a tough spot today, or this is about to be a difficult situation. Well, take their advice. Use the medication. That's what it's for. So preventatively, anticipate situation, monitor physiology, advice. The second set of situations is abortively. Again, my advice in my practice is I always make sure a person has other anxiety prevention or anxiety mastering skills. I've left a video on one of them earlier. And I encourage them, as the anxiety is coming up, to try to master it. Try to master it using something other than the medication. The medication tends to be a later rescue. Number two, they have to have a hierarchy of their physiology. How do you do this? You, in a calm moment, sit down and make a scale, 3 out of 10, 5 out of 10, 7 out of 10, 9 out of 10. 3 out of 10 anxiety is maybe like we were talking about, tension in your neck. 5 out of 10 is an increased heart rate. 7 out of 10 is flushing an upset stomach. 9 out of 10 is that shallow breathing, and you're basically at a full-blown panic attack. And then you pick where on that ladder you use the medication. So as soon as you start having the flushing, and you've tried some other rescue method, some breathing, some 6-second relaxation technique, you use the medication. Some people don't monitor their physiology as well. They're more in touch with their thinking. If that's the case, I recommend they do the same hierarchy. A 3 out of 10 is when you start saying to yourself, when is this going to be over? 5 out of 10 is a prediction, affective forecasting. I know I'm going to struggle with this. This is going to be awful. This is going to be a nightmare, right? Predicting. A 7 out of 10 is maybe when you start thinking other people are noticing. People are looking at me. People know that I'm freaking out. And then a 9 out of 10 is when you're at full-blown catastrophe. This is going to ruin my career. I'm going to get an F on this project. Again, you pick where on that hierarchy. You make the intervention. Make sure you've tried some other intervention first. And if you have, you're continuing to climb, you take the medication. I hope this was helpful. My goal is to educate and hopefully improve someone's life. If you enjoyed the video, please hit that like button and subscribe or share it with someone.